speak to you about a project we just completed in partnership with the Ontario Ministry of Health and Long-Term Care to support families of children with medical complexity. And specifically, we wanted to provide the background information on the work and showcase our resource, the Peer Support Toolkit. So the work we're sharing with you takes place at Holland Bloorview Kids Rehabilitation Hospital. Located in Toronto, we are Canada's largest pediatric rehab hospital, serving children from birth to 19 years with disabilities and ongoing complex health needs. Specifically, the project we're discussing today was led by Evidence to Care at Holland Bloorview. And we are a team of knowledge translation specialists who are supporting the hospital in its strategic aims to accelerate knowledge and transform care. And our vision really is to promote the best available research evidence to inform care in childhood disability. Oh, all right. So to provide some more context, in 2013, we partnered with the Ontario Ministry of Health and Long-Term Care to support a best practice project. This work began with a very specific focus on children with medical complexity, which was identified as a priority by the Ministry of Health. Through a number of consensus activities with healthcare providers and family leaders, supporting families of children was identified as the priority. So as we know, caring for a child with medical complexity and other lifelong disabilities can lead to intense pressures on families. And the research literature speaks heavily to the extreme juggling acts and stressors families face. Not surprisingly, ongoing financial, social, physical, and mental stressors put families at increased risk for burnout, impacting their health as well as potentially that of their child. Therefore, supporting caregiver stress was of critical importance and was selected for this work. So given Evidence to Care's mandate to enhance access to research evidence, we started by asking what interventions currently exist to support families of children with complex health needs. And we decided to come at this question in a few different ways. We conducted a scoping review to capture the available research evidence. We complemented this with a provincial scan through key informant interviews. We really wanted to get a sense of the types of programs and services that existed to support families. We also engaged community partners through a gathering evidence workshop to review the findings and identify next steps. So just briefly, through the scoping review and key informant interviews, we found quite a bit of overlap in terms of interventions and programs to support families, both in indirect and direct ways. For example, care coordination, having a medical home, telemedicine support, really share a common focus on coordinating care across the service spectrum. And although these interventions weren't directly targeted to supporting caregiver stress, what we found in literature and through the interviews was that enhancing care coordination truly had an impact on caregivers in an indirect way. In addition to these, interventions like respite, peer support, and financial aid were some of the interventions identified that directly target specific stressors experienced by families. And one area in particular that received a lot of attention was the importance of access to quality respite services, both in-home and out-of-home, to reduce caregiver stress. Lastly, another major theme that emerged was the role of parent-to-parent peer support initiatives, ranging from in-person support groups to even online groups such as Facebook. Through the workshop, we brought together 30 healthcare providers and family leaders and Ministry of Health representatives to review these findings and consider next steps for the project. Through this workshop, we generated a number of ideas to support families, including a need for greater awareness of existing resources and services. For example, some healthcare providers and families commented to enhance access to respite services. There are some services out there that aren't being utilized. So increasing awareness of what's already out there was one area that was identified. There was also opportunities for enhanced training around the specialized needs of these children and their families. Quite a number of families we spoke to commented that they're often the experts in their child's care, just given the complexity of the situation. So if they have in-home respite or personal support workers, they often feel as though they have to sort of mentor and train. So they thought that there could be opportunities around enhanced training. Workshop participants also talked about the importance of creating mechanisms to aid families as they navigate the health system, as they see so many healthcare providers in different places. So there was some discussions of creating a toolkit for them or an app. And I would say across the scoping review, the scan, and the workshop, peer support was a key theme that emerged. We heard from many families the benefit of speaking to other families who are going through the same journey. In addition, we heard that peer support was a way families learned about other programs and services that we found, such as respite and financial benefits. So peer support was really seen as an area that brought it all together through that lived experience. So recognizing what we heard from our knowledge users and given our mandate and the scope of the work, we chose to further focus on peer support to create an evidence-based resource. There's a lot of information out there on peer support models, ways it can be offered, and programs across the province and across Canada. But what we heard from our community partners and family leaders was that there was a need to mobilize this information into one resource, tailor it to the disability context based on the best available evidence. So I'm going to hand it over to my coworker, Christine, who will walk you through our peer support toolkit.
So with peer support as our priority area and hearing from our end users the need for a centralized document, we decided to create a toolkit based on feedback that we've received. And to do this, we used a multimodal approach. So as Julia mentioned, we engaged over 30 end users, including families, program providers, and community stakeholders. We also looked at related resources and toolkits from other sectors, including mental health, and we did a rapid evidence review of the peer support literature specific to families of children with medical complexity and other life disabilities. All three of these activities inform the content and development of the toolkit. So the result of these activities is our peer support toolkit. And we have structured this resource into 4 sections, which is freely available from our website at www.hollandbloorview.ca/peertool. So the goals of the toolkit were to increase awareness of the role that peer support plays in supporting families, provide a synthesis of the current peer support research, provide a resource to facilitate program providers in designing, delivering, and evaluating programs. So now I'm going to give you a sneak peek of each section of the toolkit. So if you're looking for background information and research evidence on peer support, or we want to have an understanding of families' experiences with peer support, then Section 1 is where you should start. Section 1 also identifies 3 key peer support models: in-person, online, and parent matching. When creating this toolkit with our working group, we heard from them that they spend a lot of time reading through multiple resources and going to several places to find the information that they are looking for. They really identified a need to have a single resource that brings together all 3 models. Here's a sneak peek at the family stories. So the stories that we showcase provide various perspectives on peer support, ranging from challenges to finding the right type of support, to the value of connecting with others who truly get it, in terms of the journey that a family experiences when caring for a child with medical complexity or other lifelong disabilities. If you are looking to get a sense of some of the different peer support programs that are out there and how they work, then check out Section 2. In this section, a variety of programs across Ontario are highlighted through a case study approach. For each program, a program description, facilitators and barriers to program development, and delivery are shared. Key recommendations to consider when developing a peer support program are provided, and information contacts are also available. The case studies that we share highlight a variety of in-person, online, and parent matching programs in a variety of community and hospital settings. What is valuable about this section is that it provides a platform for individuals who are thinking about creating a program or want to tweak an existing program to network. So here are just a few examples of some of the programs featured in this section. If you are looking for resources to help you get started, Section 3 is for you. In this section, information and best practices from other toolkits is shared to guide program providers. There's a great resource matrix which synthesizes this information and provides links to resources. There are also templates to help program providers identify SMART goals for their programs and evaluate the impact of their program. So here is a sneak peek. As I mentioned, this section of the toolkit uses a frequently asked questions style to share information. For example, some questions we heard from our end users were, how can I find funding? Or, how do I decide on topics for my peer support sessions? What can I do to take care of myself so that I can continue supporting the group? We outlined 16 FAQ questions like this with additional resources attached to each section. So here is a snapshot of the resource matrix, which provides a summary of all the resources we look to inform the FAQ answers. What is great about all three of these sections of the toolkit is that they are informed by our knowledge users. Individuals who are running a program, individuals who want to create a program, volunteers, parents, and clinicians, to name a few. The content that they wanted for the toolkit is all there. As I mentioned, we also include a few templates for program providers to use in their context. So for example, one thing we read in the literature is the need to evaluate peer support programs. So we created this evaluation planning template for program leaders to outline their evaluation goals, as well as their process and resources for getting the information they need, whether it be to augment or share the success of the program. Lastly, if you're looking for the state of the evidence and want to read some key research articles about peer support, then you should take a look at the Rapid Evidence Review. In this last section, a rich description of the methodology and key findings from a rapid review of the peer support literature are provided, and this is done in greater detail than what is outlined in Section 1. Summaries of the relevant systematic reviews are also provided in this section. So here is a sneak peek of the Rapid Evidence Review. If you are building a case for funding, then this section may be valuable to demonstrate the evidence of peer support, or the evidence to support peer support programming. So, as I mentioned earlier, you can download the toolkit at www.hollandbloorview.ca/peertoolkit. It is freely available for download. As part of the download, we've included a voluntary form for people to fill out with their email, their role, and their organization. And this information helps us to see how and where the resource is being used. So thank you very much for listening to Julia and I today to talk about the Peer Toolkit, and we'd be happy to address any questions that you might have.
Mm-hmm. We'd also love to talk to this group as experts in the field. If you have any ideas of where we could share this resource or where you think it could be a good fit, we're happy to sort of have that discussion now as well. So.
Hi, one quick question. It's Anna Cooper. How are you finding the use of this? What sort of feedback are you getting?
We've had great feedback so far. So we've launched for about a month. We've had over 800 web page hits so far. And we've really been trying to send targeted letters. We have quite a group of champions who helped us to create the resource, who are spreading it with their networks and colleagues. And I think some of the feedback we've had from presentations and even informally connecting with others is that they're really glad to have a resource that they can go to when they're starting a program, and they wish they had had it almost a year ago when they were in the same position. So I think so far we've had some really great feedback in different ways that it can be used.
Mm-hmm.
Any other questions?
Actually, this is Lisa. I'm just was wondering, I know you want to get a little bit, as a thought of a way to sort of spread the word a little bit more, if you'd consider maybe writing a blog post for our CAPHC conversations with links to the toolkit and maybe a little bit of a description of it, and And that can go out to the larger CAPHC community, and we have a lot of families who are subscribed to our blog. So.
Absolutely,
it's humane, Lisa. I really think that would be very beneficial for our colleagues at Holland Bloorview, and even more so for the community. I think that's a fantastic idea, and the readership is great.
Great, that would be fabulous. We actually have a colleague, some of you may know Krista Kilty, who helped us as we created this resource, and she was able to share it with a complex care listserv in the United States, and we had some really great uptake from that, and some people messaging us, and some downloads as far as Japan and Argentina. So I think we're definitely up for any suggestions, and I think that CAPHC blog would be great.
Super. Any other thoughts from across the country here, from out west, or?
Just going back to what I was asking earlier about feedback, how about family feedback? Are you finding that they're using this directly as well?
Well, in terms of the way that we create, like the toolkit was created for program providers with that lens in mind. However, we heavily engaged families in the development of the toolkit, and I think what we heard from them was that the information is provides a really good platform for them to best find out how to reach out to other peer support programs, or help them identify what they would need to help meet their needs in terms of peer support and what model might work for them. So although it was created for program providers in mind, we have heard that it is useful for parents from that perspective.
We also have quite a few parents, even here at Holland Bloorview, who are in paid roles developing programs. So if there's family leaders in the community or in a hospital setting who want to create a program, this resource would be great for them as well.
Yeah, I could see families.
Hi,
Go ahead.
Sorry, this is Tammy. I was trying to find a moment to pop in. I'm from BC Children. Thanks, Julia. That was a really interesting talk. I didn't catch all of it because I was still having some technology problems on my end, but is there, aside from these documents, which are clearly extremely useful, are there some active sort of personnel-based peer support programs out of Holland Bloorview? Like, has this been used institutionally to develop some programs at your local center, or do you see that being coming in the future, or was there programs already in place in terms of peer support?
Yeah, we do have quite a number of programs here at Holland Bloorview with a really strong client and family integrated care focus. So we do have some parent talk in-person support groups that are already up and running. We do have a family leadership program for family leaders to be involved in committees. And I know that there was talk to look to the toolkit to help inform potentially a one-on-one parent matching model, although I think that's still very early days. So definitely we've been working closely with that client and family integrated care team, and I think they see some opportunities to use this as a platform to look at some of the programs.
That's great. Thank you so much.
Okay, great. Any other questions? Okay, I will take that as a no.